A woman's health changes throughout every stage of her life, and understanding her body better means that this is the first step towards better health. Hello, welcome to Women Talk. You're here with me, Nadia Heng, your host. And today we're talking about something incredibly important. For women's health, our health tends to evolve through every stage of our life, from puberty to pregnancy to menopause. And our hormones play an important role in all of these changes, as well as to our breast health. And despite that there is greater awareness about this topic, a lot of women still have plenty of questions in regards to what's normal, what are the early warning signs, and when exactly should we be seeking medical help? Well, today we're going to explore all of this. We're going to explore hormones, breast health, as well as cancer. Everything that a woman should know. In fact, we're going to cover the common concerns, debunk some of those popular myths that have been perpetuated, and understand the importance of early detection. And finally, we're also going to address and take a look at some of the latest innovations and treatments. So here in the studio, we have two incredible specialists with us. We have Dr. Nurmaya Kitan, who is a consultant breast and endocrine surgeon. Thanks for joining us on the show.
Thank you, Nadia.
And also Dr. Christina Lai, consultant clinical oncologist. Thank you, ladies, for being here to address this very important topic. Now, before we dive into our conversation, though, let's first take a moment to learn more about Hospital Picasso.
Since beginning operations in June 2024, Hospital Picasso has focused on two key areas: advanced surgery and cancer care. The name Picasso stands for PJ Integrated Center for Advanced Surgery and Oncology. Located in Petaling Jaya, the hospital has a dedicated cancer center with facilities for screening, imaging, and treatment. Its technology includes the Electa Harmony Pro, a radiotherapy machine that is the first of its kind to be introduced in Malaysia. Other facilities include a 3T MRI, PET-CT, 3D mammography, and ultrasound. Each technology serves a different purpose, from helping doctors detect and diagnose cancer to supporting treatment. Together, they form part of Hospital Picasso's integrated approach to cancer care.
So with that, ladies, once again, thanks for being in the studio. Dr. Nurmaya, Dr. Christina, today we're going to talk about something incredibly important, hormones, our breast health, and cancer. So let's begin with, it's a little bit heavy, but I think it needs to be addressed, the elephant in the room. Many women are aware that, when it comes to breast cancer, it's still incredibly common. So why is it important for us as women to have awareness about this topic?
It is important to aware that breast cancer is the most commonest cancer among women, and many patients die because of breast cancer. And furthermore, breast cancer is happening to younger age of patients nowadays as compared to many years ago. It's mainly involved older age group, but nowadays we see ladies at the age of 20s and 30s getting breast cancer.
Dr. Christina, what's your take?
Well, I think breast cancer screening is one of the most successful screening programs out there. So I think public awareness remains a very important topic here. And it's important for people to understand the earlier you diagnose breast cancer, the success rate is very high. So it's still a very relevant topic for the women out there.
So despite the fact that there is a lot of awareness about it, it's important to keep it on our radar. Remember
Absolutely.
to go for our screenings. Yeah. Don't take it for granted. Yeah. I want to ask you a question about hormones, right? Dr. Nurmaya, perhaps you can help on this topic. There is clearly a link between our hormones and our breast health, but maybe you can elaborate on what is that relationship between hormones and breast health, and what is it that we as women should understand about this link?
Okay. Hormones, especially estrogen and also progesterone, they plays an important role in the breast development and also the changes throughout the women's their entire life. And the hormones fluctuates during their puberty, and also it changes during their pregnancy, and also during lactations, and also after menopause. So all these changes cause the breast tissue to feel different way in each
cycle
cycles of stage. So that's why women needs to know how their breast feels like in every this stage, because sometimes if they don't do their breast examinations on their own routinely, they might not know how normal breast feels like. Yeah, so they easily can miss if there is any abnormality in the breast.
Especially if there's any changes that are occurring. If you don't know what it's meant to feel like or what the norm is, you'll completely miss the change.
Yes,
which brings me to my next question. When we talk about breast changes, lumps, or any pains that you experience, they're not all necessarily bad, right? Some are completely harmless.
Yes.
So how do we distinguish what is harmless and what is a red flag that we should not be ignoring?
Okay. If we often feel our own breast every month, so we know which feels new and which feels existing conditions, right? So if there is any new symptoms such as lump or pain, if the pain or lump persistent after 2 weeks or after the next cycles of your menses, then I think that is a red flag that you should come forward and do a proper checkup.
So if there's a pain consistently for after 2 weeks,
yes,
then that's a sign that you need to go and get it checked.
And especially if it feels different from the usual.
Is there a good time of the month to check? Should it be before or after your menses?
After menses.
After your menses.
Yeah, because before menses and during menses, usually your breast feels like sore and tender. Yeah, so you wait until after menses.
Okay. Well, ladies, we've got plenty more to talk about, but stay tuned, don't go anywhere. We'll be right back. Welcome back to Women Talk. Here with me in the studio is Dr. Domaya Kitan and Dr. Christina. Thanks for being on the show, ladies. So now it's time to delve deeper into this discourse, and let's start to separate what's fact from what's fiction. Dr. Christina, let's say a person gets diagnosed with breast cancer. Obviously, this is an incredibly overwhelming experience, but if it's detected early, what actually are the treatments that are options that are available, and how far along have the outcomes come over the years?
So for us doctors, it's always good to have the diagnosis early, and that gives us more options. So I think most women are worried that they have to have a very extensive surgery. So when the cancer is diagnosed early, the surgery can be very minimal.
Right.
And of course, with treatment options, most of the time now people worried about chemotherapy. And if you're diagnosed early, there may be options to avoid all this toxic treatment that we may have to offer, you see. Yeah. So early diagnosis is very important.
Okay. And if we talk about another myth that we often hear, hormonal replacement, birth control pills, soybean products, these have all been linked supposedly or allegedly to increased risks of cancer. Which ones of these are actually myths, and what is the evidence actually telling us?
Okay, so there is actually some data to suggest that hormone replacement therapy or the birth control pills may increase the risk of breast cancer. The important point here is to understand there are many different types of birth control pills and also hormone replacement therapy. So I stress to patients that don't go and buy it yourself over the counter. You should see a doctor, because for us doctors, we would check your medical history, your risk factors, and we look at the person as a whole to see which is the best treatment for you, you see. When it comes to soya product, that's a total myth. Yeah.
Okay, well that's definitely reassuring considering how much I love tofu pho. Well, that being said, let's talk more about hormones and hormone levels. Dr. Normaya, let's start off with you first. For our hormone levels, is this linked to our breast health and breast density? And actually, what is the significance about this?
Breast density is influenced by age and also the genetic of the patients. As we get older, breast density will get less and less. Basically, why it is important to know your breast density, because the higher density, the higher density of your breast, it will increase the risk of breast cancer.
Really?
Yeah.
So the higher the density, the higher the risks of breast cancer.
Yeah.
Okay.
So it could be related to genetic. A certain race, their breast is more dense than certain race. So that's why among Chinese, the risk of breast cancer is higher compared to the other ethnicity.
Okay. And if you're a certain age, like different cycles of your life, the density also changes, right? So when you're, let's say, in your mid-30s, would it be denser than, let's say, in your mid-40s?
Yes, because of the hormone levels, the estrogen, progesterone is higher during a younger age, so your breast more dense during that time. But as you get older, then it's become less.
But that doesn't necessarily mean that you have a higher risk of getting breast cancer in your 30s because it's denser.
And it's normal.
Okay.
I mean, dense breast is normal breast, actually.
Okay.
It's just that you need to be aware, and probably you need to go for routine screening for breast checkup.
Okay. Dr. Christina, would you like to add as well to the importance and significance of our hormone levels in relation to our breast density?
Yeah, so if you have dense breasts from increased hormones when you're younger, it can make it a bit more difficult when you do scans like a mammogram for the radiologist to look for any abnormalities. And it's also quite difficult for you to feel, right? Let alone the patient, the doctor also may find it hard, because that's the density that caused the younger women to have more perky breasts, to say. And as you get older, that gets a bit softer. So I think that also has implications on the doctors, how we look at your scans and whether you need more tests. So in a very dense breast, we cannot see anything, but we suspect something, we may ask the patients to do more investigation, like an MRI breast, for example.
I see. All right. Well, ladies, thank you very much. We're going to continue on this conversation right after this break with more. Don't go anywhere. Welcome back to Women Talk. You're with me, Nadia Heng, your host, and here in the studio is Dr. Normaya and Dr. Christina. So we've already covered everything from hormones to breast health to the treatments. So in this segment, we're going to focus more on prevention. But before we do that, Dr. Christina, I would like to ask you how hormonal conditions, let's say thyroid disorders, do things like this actually increase the risk of breast cancer, and does it affect your breast health?
So thyroid hormone disorders is very important to be treated as well, and it can affect our general well-being. But overall, there is no link between thyroid hormone disorders and breast cancer. So that's a myth,
That is actually a myth. That's actually very reassuring. Let's now focus on the positives about prevention. I know that we can't necessarily prevent every case of breast cancer, but from a doctor's perspective, what are some of the lifestyle changes that we should be making in terms of habits, screenings, and checks? Dr. Christina.
So I think we've stressed enough that regular self-examination is very important. Secondly, I think the usual, the exercise, maintain a healthy weight, that's critical. And I think risk awareness is also very important. So a diagnosis of cancer in the Asian context, in the family, is very taboo. We don't talk about it, right? If we have family members with a history of breast cancer, I think it's very important for us to know if there is an aunt, a cousin in our family that has breast cancer, so that we are aware of our own risks. So I think I encourage the general public to be aware of their family history as well. Yep.
Dr. Nurmaya?
Yeah, because if every woman should know their risk of developing breast cancer so that you can take action early, especially if you have very strong family history with breast or ovarian cancer, then you can come for screening earlier before 40 years old.
And let's also walk through very quickly what are the different screenings that are available depending on the stage of life that you're in. So maybe Dr. Nurmaya, you can break it down for us.
Okay, for those with a very strong family history, or they are known to have the genetic for developing breast cancer, so the screening starts 10 years earlier from the age of the family members who develop cancer. So let's say if your sister or mother developed breast cancer at 40 years old, then you should go for screening 10 years earlier, which is 30 years old. Okay. So in this age, your breasts are dense, right?
Yeah.
So mammogram is not a good way to do the screening. One, because of the exposure to radiation very early, and the dense breast will reduce the sensitivity of the mammogram. So the best, if you have very strong family history with positive genetic risk, the best is MRI.
An MRI scan?
Yes, MRI scan.
All right. And at what age should we as women really start checking ourselves and going for screenings? What is the ideal time?
Depends on your risk.
So even if, let's say, you've got no one in your family, touch wood, who has had any cases of breast cancer that you know of, what is the best age to start?
The normal risk, I mean, if you don't have anybody with cancer and you have a very healthy lifestyle, so your BMI is normal, doing regular exercise, and so the guidelines say 50 years old.
I see.
Yeah, okay. But if you are in a moderate risk, then you should start earlier. But beware, because in Malaysia, younger age group develop cancer more than the Western. Yeah, so it is very important from young teenagers. We have to teach our sisters, our daughters, to do their own breast checkup every month.
Okay. Dr. Christina, would you like to add on to that as well?
So I think most people would tell us, doctor, I don't know what I'm doing when they are doing self-examination. So I encourage you to do it every month so that when you do detect or felt something different, okay, I would say don't panic. Most of the time, a lump you feel may not be cancerous, but always get it checked out. Yeah. So don't be afraid. That's the main thing I want to empower women nowadays. Because, knowledge is power.
Absolutely. I could not agree more. Well, at Hospital Picasso, I understand you have a team of professionals, from surgeons to endocrinologists to oncologists. And I understand this is obviously a very multidisciplinary approach. I assume there's a lot of benefit to that. So could you perhaps break down and elaborate the advantages of having such coordinated care when you're seeking for answers about breast health, or maybe you're someone who's going through breast cancer treatment?
Yeah, so the multidisciplinary thing is very critical, right? Before we plan a patient's treatment, we must see the different reports that we have. So in the team, we have the breast surgeon, myself, the oncologist. We also have the radiologist who will look at the patient's scan carefully, and then as well as the pathologist who will read the biopsy report. And together we formulate the best plan that we have for a patient. So sometimes patients rush, they have a diagnosis, and immediately they want surgery. So usually I tell patients to calm down because we all have to look at each segment to make that decision.
I see. So everyone can sort of be working together in cohesion and making sure that you're making the right decisions every step of the way.
Correct.
And you really get the best care and the best chances.
Yeah, because no one doctors who are expert in everything.
Yeah.
And the most important thing is actually the sequence of treatment.
I see.
Whether you need to be given chemotherapy first or surgery up front. So all this discussion will lead to the best treatment for the patients and hopefully the best outcome for patients.
And may I add also that not each patient is the same. Not one of them. Everybody will have a different treatment plan. Yeah.
So that means, depending on case-to-case basis, the
Absolutely.
chronology of what you do could vary. So you could have a friend who has breast cancer, and they will tell you, this is exactly the routine that I went through. In your head, you're thinking, this is what I've got to do. But that's not necessarily the case.
That's right. Yeah.
Because breast cancer is very unique. They have many types of breast cancer, and individual patients also different. So some patients, you have to think about their fertility, whether they want to preserve their ovary. So before we start on chemo, we have to preserve the ovarium first, so that they have chance to have their family. Yeah.
I can see how this must be very, very helpful, especially if you're a patient, you go to somewhere like Hospital Picasso, and essentially all the specialists are talking to one another. You have the information of the same patient, and you're able to make the best decisions for yourself, tailored to your unique case.
Correct.
Well, ladies, it's been so inspiring. Before we wrap things up, do you have any final words that you would like to share with women out there who are watching and learning today about hormones, breast health, and cancer? If there's one takeaway that you would like to share, what would it be? Dr. Christina?
So I would tell the women out there to be brave, look after yourself. Do not be afraid to seek out help when you need to. Yeah, and don't think that breast cancer is a death sentence. It's very, very well treated nowadays with a lot of advancement.
That's very positive. I love that. And Dr. Nirmaya?
Ladies out there, know your breast well. Any changes, come forward for proper examination.
Amazing. Thank you so much, ladies. Thank you, Dr. Nirmaya. Thank you, Dr. Christina, for lending your time and your expertise today on the show. For me, one of the biggest takeaways as well is that as women, we should understand that it's completely okay to be open and to talk about breast cancer, and you should not have to suffer in silence. Of course, the more we understand our body as well, as we've just heard, we'll be able to understand the changes in our body. And that allows us to go and get checked and have a much better way of preparing ourselves for any eventuality. And I love the fact that at Hospital Picasso, as you've just heard, they have a team of experts and specialists who are all ready and waiting to help you and provide you with the right care and right support. So you do not need to go through this alone. So remember, don't be afraid, be brave. If you have questions, make sure you ask. And most importantly of all, always go for your regular health checks. With that, if you love today's topic, please engage with us on our social media platforms at Women Talk TV3 and at TV3 Malaysia. I'm Nadia Heng, signing off until the next time. Take care, everyone.